Hello, my name is Emile Nuwaysir. I am a scientist and the CEO of Blue Rock Therapeutics, a wholly owned division of Bayer Pharmaceuticals. And on November 9th, 1989, when the Berlin Wall fell, I was a senior in college, finishing up college in the United States, getting ready for graduate school. Well, though I can remember that I wanted to be a soccer player, a football player. I really wanted. I'd have played for, room and board for food. Um, that didn't work out. But honestly, I don't remember what I really wanted to be. I mean, I remember being really fascinated with nature, with birds and bugs and plants and how things worked in nature, trying to understand them. I suspect that what I do today, which is basically using my skills to help translate this amazing, this wondrous science that we're pursuing into wondrous medicines, is just really a more sophisticated version of being a kid and being really fascinated and amazed by nature itself. So I guess, I didn't imagine myself being a PhD biologist and running biotech companies. No. But I think it's a lot like just being fascinated with the way nature works and understanding it. So I think they're related. So the problem is that there are hundreds of millions of people worldwide that suffer from degenerative diseases that the healthcare system has labeled intractable. What that means is that medicine really has no answer. All we can do is manage the patient's symptoms, often as they continue to decay and degenerate and suffer from the disease over a lifetime. There's 42 million people worldwide that suffer from heart failure and Parkinson's alone, and we have really no answer. The standard of care for Parkinson's was developed in the 1950s. That's the major drug that we use to treat Parkinson's was developed the decade before the Berlin Wall was erected. That gives you an idea of how difficult this challenge is to crack. The fundamental problem is that in degenerative diseases like Parkinson's and heart failure, the patient's tissue cells, healthy cells, are lost. So after a heart attack, that patient can lose over 1 billion heart muscle cells in that first hour. And that's because the blood flow stops and you're left with scar tissue. That scar tissue simply can't pump like a healthy heart muscle cell. And so degenerative conditions like this require a fundamentally different approach. A drug just will not replace the beating heart muscle. You have to come up with a better idea. And I think at Blue Rock, we have that better idea. The essential new finding in our work is the invention of the induced pluripotent stem cell, or an iPS cell, about a decade ago. Scientists in Japan and the US showed that if you take a normal adult cell, in their case, they took a skin cell, and they were able to convert that skin cell into a personal stem cell, and they called it an induced pluripotent stem cell. They did it by forcing it backwards in development. That cell has two fundamental properties that make it a very powerful potential tool for medicine. The first is that if you, under the right conditions, you can turn it into any cell type in the body. This means that we now have access. We can make pure human heart muscle cells, for example. And the second property is that it will divide and double every day, so you can expand it. So under industrial control with the right quality system, you can grow these cells up and turn them at high fidelity into a pure heart muscle cell. And those we could not get otherwise. And those are a very powerful tool, we think, in our efforts to reverse heart failure. Um, our lead program for Parkinson's, in that program, we intend to put healthy neuronal cells back into the brain of a Parkinson's patient. And by doing that, we intend to restore motor control to that patient. This would be an incredibly exciting step for Parkinson's patients who suffer from this debilitating disease. But I think just importantly, there's a wider implication for our trial and our program, because if we succeed, we'll have proven that you can reverse degenerative disease. That's not simple. We've put healthy neurons back into the brain of a patient and restored a neural circuit that was lost to degeneration. This is a first for science. It's a profound leap for Parkinson's patients, but I also think it's a breathtaking leap for medicine and for humankind. We will have proven that you can reverse degenerative disease. There are many questions that remain unanswered and that lie ahead for us in our journey to reverse degenerative disease. How long will the therapy last? Will we be able to completely reverse the motor control deficit and the symptoms, or just partially reverse it in the patients? Will the body reject the therapeutic cells as non self, much like it does an unmatched organ transplant? Exactly how many cells are needed? A lot of these sort of technical details, we just don't know. How big is the dose? These are examples of questions that we'll answer over the next several years. But mostly, I lie awake wondering what else I can do to make this real. I've seen Parkinson's up close. Too many people have, and it's affected some very close friends of mine. And I want to do something about it. And so that's pretty motivational when you can see your friends' faces when you think about the problem you're trying to solve. And every day I wonder, every night pretty much, what else can I do? How can I make this become a reality? That's what I wonder about every night. Now, I honestly don't know what my mother thinks of my work. I think she's proud of what we're trying to do. I know she knows that I believe in it, and she knows that it's worth doing, and that means something to me. But I do know that my kids understand the value of what I do, and what we're doing. That we're trying to make a difference in the lives of millions of people that suffer from these terrible diseases. They know that dad is totally focused on that, and maybe obsessed with that goal, and that he's doing it because it means something to him. And it's important to me that they understand that I'm doing something that's worthwhile, that means something bigger than just a job. And I hope when they grow up, they find their own purpose in life. I'm trying to show them how fulfilling it can be to have one. And I hope they find their own purpose and they're as motivated and it drives them in the same way that mine drives me.